There's a couple of good ones here.
Could we ask the
Please.
young man who was sleeping on the floor behind you a question? Up until recently, we've heard a lot of stories of hardships on the front line owing to a shortage of PPE, masks, that sort of thing. Can you tell us, did it get bad where you were, and what's the situation?
As I do more testing, they say, for capital cases, they're very smart, but they're very devious people, and in many cases, very bad people, and in some cases, very good ones. There's a couple of good ones here.
Bad, but manufacturing ramped up, and I think those are two things that we knew we would take care of as a country. The third thing that we can't manufacture, and I've talked about this before, is a doctor or a nurse or essential personnel. We can't just manufacture them. So ultimately, that ended up being the weakest point for us on the front lines. We had the PPE, we had the ventilators in time, but we just didn't have enough people. We couldn't get them there fast enough.
And one of the things we did is we sent in the military doctors and nurses, and I think most of you have seen them and some of you have worked with them, but they did a fantastic job. John, we had a lot of the military, like we took the Comfort because they didn't need the ship, and we took the Comfort and we took the doctors and nurses and we sent them all over New York and New Jersey. We took doctors and nurses out of the convention center, the Javits Convention Center, and many of them went throughout New York. So we did a job. And we weren't even supposed to have doctors in the convention center, but we ended up putting there. So we had a lot of, because it's true. And we took power was one of the toughest things.
Mr. Luke, are you, and all of you, are you seeing now that the supplies are what they need to be?
Yeah.
Yes. I think it's sporadic. As I talk to my colleagues around the country, certainly there are pockets of areas where PPE is not ideal, but this is an unprecedented.
Man and woman power was one of the toughest things.
Time. And I've been reusing my N95 mask for a few weeks now. I just broke out a new one to come here just in case I needed to wear it. To answer your question earlier, we're all COVID-19 free. We were all tested. Yes. So we're not socially distancing, but we're all negative, and we wouldn't do anything to harm at a time. And the infection control measures that we learned back when we went to school, 1 gown, 1 mask for 1 patient a day or per time. This is a different time, and I've certainly, and I've had several tests throughout this whole COVID-19 crisis. I practice in New Orleans at a community health center. My youngest patient has been 4 days old, a 4-day-old infant, so PPE has been sporadic, but it's been manageable, and we do what we have to do. We're nurses, and we learn to adapt and do whatever the best thing that we can do for our patients to get the job done and get the care provided. And that's what we're going to continue to do as COVID-19 continues.
Sporadic for you, but not sporadic for a lot of other people.
Oh, no, I agree, Mr. President.
Because
Absolutely.
I've heard the opposite. I've heard that they are loaded up with gowns now, and initially we had nothing. We had empty cupboards, we had empty shelves, we had nothing because it wasn't put there by the last administration. And I've heard that we have. I just saw it yesterday where they're making millions of masks a month in a factory from, in that case it was Arizona. It's great. We have other factories being built now for masks, and for the most part, I mean, that was fine, but I've heard we have tremendous supply to almost all places. Tremendous supply to a point, in that case it was Arizona. It's great.
The way we did things, but.
Yeah.
You'll end up being a star.
And Mr. President, I just want to add one thing too. I'm a nursing supervisor where I work at, and one of the blessings I have is my director, my assistant director, his name is Dennis Hunter. He said, you know what, you guys take care of nursing. We'll make sure we have a supply. Mm-hmm. When we all talk about the fears, it makes it so much worse for us nurses to work. We're seeing the reality of it, but to hear it on constantly, there's not enough, in reality, I'm not seeing it. I'm in a hot zone right now. I'm in South New Jersey. All right, we're very close to New York.
And so you don't
Slow
see
down.
that when you hear the
I'm not
stories.
seeing it.
You know why? Because they're
You know?
fake news, that's why.
I have to say,
I really appreciate you saying that. It's so nice that you stepped up, because they're fake news.
Respectfully though, sir, at the beginning.
No, when I took over, it's different. Now, I will say this, there was a period of time, but between Russia, and all the stuff that these characters put us through, it's
I'm not seeing it.
I've done more than any other president in history in the first 3 years as president.
What I was-
And you can look at that from any way you want to look at it, from rebuilding the military, to cutting taxes, to getting rid of regulations at a level that nobody's ever come close to saving your Second Amendment, which is under siege, by the way. So, you know, we've done, but I really appreciate your statement. That was really beautiful, and
On
we
the
did.
issue of masks, I mean, I remember at the beginning of this crisis that you all were
That's
encouraging
right. We
people
didn't have enough.
not to wear them in order to have it for them.
You're right, but
So
that was
there
at
was
the-
not enough at the beginning.
You're right, Jeff, and the reason that we did such a good job is because we were able, now we have factories all over doing masks and building our own masks and doing them, because a lot of countries, I don't want to be specific, but they sent us masks which were total garbage, and they were defective. And they sent us other equipment which was defective. And so now we're building our own masks, we're doing our own masks, we're making them by the millions. And Honeywell in Arizona yesterday was a case in point. And that was some scene. I've never seen anything like it. And I didn't realize, as they put different layers and then they put it together, and each layer has a different function. I mean, you know, it's not just like taking a thing and wrapping it, as we said perhaps you can do in certain conditions, but certainly not inside of a hospital. But no, we ended up, we had an empty cupboard, and now we have full cupboards, and we have ventilators, and we have as they put different layers, and then they put people that don't believe in such big testing, Deborah. I mean, you know, you have some people that want to test everything, 15 different ways. Mostly that's the media, because they know, you know, certain things can't be done. But we have tremendous testing right now. When you see that chart, I don't have it with me now, I guess they have it someplace in the room, but when you see the chart that I put up yesterday as I was interviewed by one of your friends on ABC, that chart says it better than anything I can say. You saw the line going? We're like a rocket ship, everyone else is down here in testing, and then all they do is complain about the testing. So look, you get used to that, but I really appreciate the fact that, what you said, and we have great, and not only do we have great equipment, but we have the quality of what we have is far better than anything that we're getting, because we see what comes in. The quality of the gowns, the quality of the masks. We have, as of today, we got 1 billion gloves. 1 billion. Who ever heard of such a thing? At the beginning, we had none. You know, when this all started, we had none. It's one of the greatest mobilizations. It's a war, and it's one of the greatest mobilizations. So it's been very successful.
President, one more question about reopening. The initial forecast showed that the real decline in the infection curve would be about June the 1st.
Who ever heard of such a thing? At the beginning, we had none.
Of August.
I mean, I'll just address one part of that. The school should open. The one thing you should be careful of is when instructors are over 60, especially if they have a problem. That you should be careful, but the school should definitely open, in my opinion. Could you answer the other part, Deborah?
So I think you're referring to the model that looks at mortality.
We talked about this.
And the mortality is very variable. That model has gone from 60,000 now to 134,000. Obviously, we track mortality very closely. You can see the rate of new hospitalizations has gone dramatically down, and so we're following that and mortality very closely. And so we all know about models, and that's why we follow the data metro by metro. And you know, we have represented here New Orleans that has moved through a very large peak and has come down the other side, same with Detroit. We continue to watch Chicago very carefully. We know that both Boston and Philadelphia are still working through a very difficult time. So the country has moved as individuals, and what we are so proud about is how much the governors are using testing in a focused way. So they're not just diagnosing the individuals that come to the hospital with symptoms. They're proactively going out and testing in nursing homes and prisons. Both Boston and Philadelphia are still working through a very spread, because we've been talking about it for 2 months, but now finally it's really getting picked up that there is asymptomatic spread, and that's why Governor is using that strategic testing to ensure that the most vulnerable, those in disadvantaged areas of the cities, in multi-generational households, those in group, and testing everybody when they see one case in a meatpacking plant. And this is really allowing us insight, and we really appreciate the media calling out the asymptomatic spread, because we've called that out as a very key point.
Do you think we'll be in a place in August where schools, at least in some states, will be able to reopen?
Well, again, it's a county-by-county, state-by-state decision, and that's how we're collecting data, and we're hoping, and we are asking all of the states to have a very, very great data system so that every community member can see what's happening in their community, both with hospitalizations and testing, and unfortunately any mortality. So these decisions can be continuously updated, and we're seeing that. We're seeing much better sites at the state and county level to really inform the public in a very clear way.
But Mr. President, you say you'd like to see schools open, just have people or teachers who are in risky age groups not go in or be more careful?
I would like to see schools open wherever possible, which I think is in much of the country, most of the country. No, I would say that until everything is perfect, I think that the teachers that are a certain age, perhaps you say over 60, or diabetes or any one of a number of things, I think that they should not be teaching school for a while, and everybody would understand that fully. That we understand. But other than that, you see how well children seem to do. It's incredible. We realize how strong children are, right? Their immune system is maybe a little bit different. Maybe it's just a little bit stronger, especially if they have a problem with heart or diabetes or any one of a number of things. See you in about 3 minutes.
Thanks, Margot.
Maybe it's a lot stronger, right? Could be a lot stronger. We've learned a lot by watching this monster. Thank you very much. Thank you. See you in about